As the survivors of the Connecticut school shootings return back to school, they're supported by the thoughts of the thousands whose hearts ached for their young classmates. The tragedy raised a debate over mental health and the resources available to treat it. Mental illness affects a person's thinking, feeling, mood, and ability to relate to others. And many seeking treatment for the diseases aren't getting the results that they need. Welcome Dr. Myra Preston with Siber Imaging to talk about another option in treating mental illness. Dr. Preston, it's great to see you.
Thank you.
As a whole, collectively, how are we doing in dealing with patients with mental illness?
Well, not very well, based on the fact that the typical approach is to begin throwing medications at patients and observing their behavior and allowing that to be our diagnostic tool.
And there's no way in knowing if the medications work until you start taking them.
That is correct. And then often we end up giving medications to counteract the effects of the primary medications, and you can end up affecting the behavior and the neurology of the person and exacerbating their mental illness.
Okay, talk about what it is that you do at Siber Imaging, the brain mapping. That has been proven to show some success in helping folks with mental illness.
Yes, it has. In the last 10 years, the science of neuroimaging has advanced and become approved to the point where it gives objective data to the physician about the abnormalities in the electrical activity of that person's brain, which tells us about the neurochemistry. That objective data allows us to eliminate trial and error in medications and perhaps get the right medication and the right dosage on board the first time.
Without that trial and error period of, oh, let's try this, well, those results weren't great or the side effects were so bad. It lets you eliminate that?
Yes, it does. And often those trial and error periods will bring on psychotic episodes and actually increase the mental illness, and that's often when tragic events occur.
What is it that you're able to see with the brain mapping that allows you to glean that information?
We're actually able to see the electrical activity, the communication of the neurons in every lobe of the brain. And that tells us about the neurochemistry. Now, medications alter the neurochemistry by altering the electrical activity. So then we bring in a treatment intervention called neurotherapy, which does the very same thing as medications, but allows us to only target the lobe of the brain that needs adjustment, leaving the rest of the brain alone, which allows elimination of side effects.
That's fascinating. What kinds of results are you seeing with patients?
2 to 3 times better improvement than medications alone. We are seeing increase in functionality, quality of life, happiness in relationships, choice of careers, and being able really to have a life and manage a mental illness.
So you've been able to help patients who were previously on medications, maybe didn't like the side effects, they weren't getting the results that they wanted, come to Siber Imaging, start this therapy, and get off of those medications?
That is absolutely correct, yes. And you know, with many of these medications for mental illness, the side effects are weight gain, affecting your sexual libido, so there's a low compliance anyway.
What about other conditions like ADHD, depression, anxiety, mood disorders? Are you seeing any results with those kinds of?
ADD, ADHD has been the most published literature in this field for success rates, and clinical studies have shown that neurotherapy is as effective as medication without the side effects, and in fact the American Psychiatric Association has just deemed that it should be the #1 level of support in ADD.
Okay, Dr. Myra Preston with Siber Imaging, thank you so much.
Thank you.
To learn more, visit siberimaging.com, siberimaging.com, that's S-I-B-E-R, or call 704-543-0427. The number again, it's 704-543-0427. Thank you so much.
Thank you.
Appreciate it.